My name is Millicent Kavayi. I'm a social worker at United Kenya Rising, and I also head Hamisi Satellite Office, which is in Vihiga County. My day as a social worker starts on a Monday morning, where I come to the office at 8. Then I make my work plan with families I'm going to visit. I also share my work plan with my colleagues to see where I'm going to visit during the week. After being facilitated, I start my field work on that very day. Before a family is taken into a program, we do assessment where we go visit the families that are supposed to be brought on board, assess them and see where the needs are and how needy are they, so that they can be brought into the program. I do field visits where I visit families that are in our program. Some of the families have different issues, so I visit them to address the issues. Like I do training in livelihood where families are trained on how to be self-reliant through livelihood and use the resources available to sustain themselves. I also do psychosocial support to families that have issues, where I come in as a counselor at some point. We sit together with the family, address the issues and see how they can also address their issues on their own without our support. And also during visit, we plan with the family on how we are going to address their needs at family level. That's where we come up with care treatment plan, where all the family needs are written down and the most felt needs are addressed first and others follow with time. I also do school visits where we have students from our families in the programs, where I visit them in schools to see their progress, academic progress, their discipline, and how they carry themselves while in school. At school, we sit together with their teachers, discuss about the student and how best the school can support the students so that they can be able to achieve their dreams with the opportunities they have. The family I can highlight most that I've worked with is the family of Kagota. At first, the family was very down, but when they came into the program, they have really done well and they have risen above poverty. They have restored their dignity in the community. Currently, they have a house, kitchen, pit latrine, washroom. They have started poultry project. They are doing farming well. They had a land as a resource, but they didn't have the information and skills on how to work on the land so that it can sustain themselves. But after taking them to exposures and other trainings, they are able to work on their land and they are able to produce much food and they are able to sustain themselves. Through family care model, families have risen above poverty, and it has enabled families and even the community to take care of their children. And like when the children were in institutions, where the institution was taking care of the children, but currently with the families, they are able to take care of their children on their own. They are able to take their children to school. They are able to check their health progress. To check health progress of their children. They are able to even start business and other livelihoods in order to support themselves and depend on the institution to support their children's education, health and other things. Even through agriculture, they have been able to learn more about agriculture and even implement what they are being taught by the agricultural officers. Family care model has also united families, where some families had relatives who can take care of their children, but they were far and they had no resources to take care of the children. But through family care model and the support we give the families have been able to be united, where some relatives have come in to help the old guardians to take care of the grandchildren. I love working at United Kenya Rising because of the opportunity we are given, where we have capacity buildings. in which we are trained in different aspects like leadership, case management, financial literacy, and it has given me the opportunity to be a leader in Hamisi region. The Hamisi office has really impacted lives in the area where services have been brought near to the community and our beneficiaries, where they are able to access the office when they have a need, and we are able to help them where we can. And I also love the unity we have as colleagues, where we support each other in serving the families we have in our programs. I thank our donors for the great support they render to us as an organization, as we are able to serve communities and families rise above poverty. What I can also tell them is to continue supporting us in getting more funds and even telling our stories to different peoples wherever they are, so that we can also get more donors and more supports as we continue serving communities and families in our program. I urge more people, organizations, companies to come and support our organization in serving the community through different support like in-kind donation, even skills, trainings and other resources they may have, in order for us to be able to continue serving communities and families rise above poverty. My parting shot is service to humanity is service to God.